Joaquinto Cruz and Jose Rodriguez Saldana were rushed to the Iowa Methodist Medical Center in Des Moines after both were seriously hurt in a car accident. Before they awoke, they were flown back to their home country, Mexico. The accident left both of them with life-altering disabilities. There is no way to know for sure whether the two men would have recovered faster or better in the United States. In the past 5 years, over 600 undocumented immigrants have been deported from United States hospitals while they were unconscious, after healthcare providers decided it would cost too much to let them stay. The federal government claims it's not involved in the hospital deportation, that it has been the decision of the healthcare providers exclusively to send patients back to their home countries without their know, all in the name of curbing medical expenses. It's so common now that it even has a name: medical repatriation, where the patients are placed on chartered international flights paid for by the hospital, all taking place in what seems to be an unregulated sort of black hole with any way of monitoring the practice.
I honestly can't believe that something like this could happen in a country such as America. And my general opinions, I just can't imagine what it feels like if somebody was to go to sleep in one country and wake up and you're in a completely different world.
With no oversight, advocates for immigrants are concerned that hospitals could soon begin expanding the practice after full implementation of the Federal Patient Protection and Affordable Care Act, which will make deep cuts to the payments hospitals receive for taking care of the uninsured.
I think a lot of people will wind up going to private doctors and be paying from their pockets, I believe. Only in extenuating emergencies, people will be going to hospitals. For example, when you're unconscious. And I think in those instances, I believe that the hospitals have to be a little more kind of concerned about the human being rather than getting them deported from the country.
Immigrant activists say the practice violates U.S. and international law, unfairly targeting the defenseless in their time of need. All hospitals are required to care for patients, whether they're citizens or not, whether they have the ability to pay or not. Many immigrant workers without citizenship are ineligible for Medicaid, the government's insurance program for the poor and elderly.
The doctors should not even be getting involved in the immigration matter, because if you look at ethics for doctors, the doctor's job is to save the life of a person. Even if that person is legal or illegal, it should not matter at all.
The stalemate is at the heart of a national debate on what to do with illegal immigrants who need medical help but don't have the means to pay for it. The issue has become an increasing concern for Florida and other border states with an increasing number of illegal immigrants. For now, at least, the kick the can down the road policy seems to be the popular approach when dealing with immigration reform. Susan Madaris, Press TV, New York.